What is bipolar disorder? Probably not what you think. Hey, I'm Dr. McCleary, licensed clinical psychologist and Navy veteran, and I make mental health videos for veterans and their families. In this video, I'm going to talk about bipolar I disorder. Yes, there are multiple types. What it is, and maybe more importantly, what it's not. A lot of people think that bipolar I disorder is characterized by these wild, up and down, hot or cold mood swings. Generally, that is not true. Bipolar disorder is characterized by changes in one's mood and levels of energy. However, wild, up and down mood swings, that's a bit of an oversimplification and just kind of rude. In order to fully understand the diagnosis of bipolar disorder, you have to understand the building blocks of bipolar disorder. Those building blocks are different types of episodes that somebody can actually experience if they have bipolar disorder. Those episodes are depressive episodes, manic episodes, and maybe a new term for you, hypomanic episodes. Let's start with defining the depressive episodes, which is probably the most familiar and arguably the easiest to explain. In order for a depressive episode to happen, an individual must be experiencing 5 or more of the following symptoms in a 2-week period. At least one of those symptoms has to be depressed mood or something called anhedonia. Those symptoms start with depressed mood most of the day, nearly every day, characterized by sad mood, feeling empty inside, or feeling hopeless. If you're getting value out of this video, go ahead and hit that like button. The second one is that anhedonia that I was talking about. And if you want to learn more about anhedonia, I made a whole video on it, and I'll link it down in the description. What anhedonia is markedly diminished or even the elimination of pleasure in doing multiple things. Think about when you do something that you used to enjoy, but somehow seem to not enjoy it anymore. That's what anhedonia is. The next is significant weight gain or weight loss. Usually what we're talking about is about 5% of somebody's body weight. Hypersomnia or insomnia. In other words, sleeping way too much or not sleeping enough. Psychomotor agitation or retardation. Sometimes this looks like slowing down, whether that's in kind of your body or your speech, to the point where other people could notice. Fatigue or loss of energy most of the day. Feelings of worthlessness or inappropriate guilt. The next one is difficulty concentrating. And the last possible symptom is recurring thoughts of death or wanting to harm yourself in some way. Maybe wishing you weren't here anymore. Sounds pretty rough, right? Those are the symptoms of a depressive episode. Some of you who are familiar with the diagnosis of major depressive disorder might have found that some of those symptoms are very familiar to you. And that's because they're the same. Now, the next episode that we're going to talk about is part of the reason that somebody might have all those symptoms of major depressive disorder, but actually have bipolar I disorder. The next episode that I want to talk about is a manic episode. And this is not fun. A manic episode is characterized by elevated energy, irritability, specific goal-directed activity, and it can get to the point where somebody has to get hospitalized because their thoughts are racing and maybe they're actually putting themselves in dangerous situations. When this mood and energy change happens for at least 1 week and the symptoms are occurring nearly every day, most of the day, then we may be looking at a manic episode. In order to meet criteria for a manic episode, you need to have at least 3 or 4 if one of those symptoms is just irritability to meet full criteria. The first symptom is elevated self-esteem or grandiosity. The next is decreased need for sleep. Maybe they got 3 hours, good to go. Maybe they didn't even sleep last night, still good to go. Maybe they're more talkative than usual or have pressure to just keep talking. Maybe they keep having flights of ideas or feel like their mind is racing. Often, when people are experiencing a manic episode, they might actually be very easily distracted. They may have increased goal-oriented activities, such as in school or work, working late hours, studying for night after night after night. The last symptom that somebody who is experiencing a manic episode may be experiencing is participating in high-risk activities. Maybe those activities are them being hypersexual. Maybe those activities are causing them to drive really fast or spend a lot of money that they don't have. High-risk behaviors that they usually wouldn't participate in. You can probably see how a manic episode can land somebody in a bit of trouble or in a dangerous situation really quickly. And it might even land them in the hospital. It's important to note that all of these symptoms don't count if they are a result of any type of medication, substance use, or a medical condition. The next episode that I want to explain is a hypomanic episode. A hypomanic episode is extremely similar to a manic episode. The only difference is that in a hypomanic episode, there is not the need to be hospitalized. There often is also not the same functional impairment in work or social activities. The symptoms are actually the exact same as a manic episode. And I know that I just explained them, but let me run them down a lot quicker this time.
Abnormal, elevated, sometimes irritable, expansive change in someone's mood for at least 1 week. Nearly every day, most of the time during those days. During this mood disturbance and high level of energy, they must also have 3 or more of the following symptoms. Unless one of those symptoms is irritability, then they need to have 4. Those symptoms are inflated self-esteem or grandiosity, decreased need for sleep, being more talkative than usual, having flight of ideas or racing thoughts, being easily distracted, increase in goal-directed activities such as school or work, and lastly, involvement in activities that have the high potential for risk, spending too much, risky sexual behavior, those type of things.
Okay, so we have the building blocks now. We have the 3 different types of episodes: manic, hypomanic, depressive. Now, what is bipolar disorder? In order to meet criteria for bipolar disorder, you have to have had a manic episode. So you have to meet criteria for a manic episode sometime in your life. You may also have had a hypomanic episode. You may also have had a depressive episode. You might even cycle back and forth between depressive episodes, hypomanic episodes, manic episodes, back and forth. Some people have one manic episode in their life. Many people have multiple. But in order to meet criteria for bipolar I disorder, you must have had a manic episode. If you have never had a manic episode before, well, guess what? Most likely, you do not have bipolar I disorder. And anybody who diagnoses you differently is probably wrong. Bipolar disorder sounds like a very scary disorder. And for many people that have gone undiagnosed and untreated for their bipolar disorder, it very much can be. But that doesn't mean that it can't be treated. The first line of treatment for bipolar I disorder is medications. So if you are experiencing some or any of these symptoms, I suggest that you consult with your doctor so they can get you started with some treatment. Medications are not the only thing that works. Although medications are the first line of treatment for bipolar I disorder, cognitive therapies can also be very helpful in identifying the symptoms, catching them early, recognizing when you may or may not be going into a certain type of episode, being able to communicate with the people around you so they can help recognize when you're going into a particular episode. That way, you can prepare for it. Here's a thought. If you can recognize that you're about to go into a hypomanic or manic episode, and you have a history of overspending when you are in one of those episodes, well, what you could do, give your credit cards to a family member or trusted friend. Those type of treatments aren't solved with just medications. There may be some therapy that needs to be had in order to fully help you live with bipolar I disorder, or really any type of disorder. So that, in a nutshell, is what bipolar I disorder is. A lot more than just mood swings. Something to think about. If this video was helpful for you, and I hope that it was, please like it or consider subscribing to my channel if you want to learn more about mental health. But more important than that, if this video was helpful for you, then that means it can probably be helpful for another veteran or another friend or family member of a veteran. So I ask that you share it with them, because at the end of the day, that's really what all this is about. One veteran trying to help another.